So today was day 3 of TMS, or transcranial magnetic stimulation treatment for depression and anxiety. And if you've been following along, you know that I'm trying to make one of these posts every day that I'm undergoing treatment to kind of keep track of my mood and see if anything changes along the way. Um, Today, so they're doing the bilateral stimulation, so they're doing like 20 minutes on the left side for depression, and those are really, really fast pulses, or fast, fast taps, and then like the 15 minutes on the right side for anxiety, and those taps are a lot slower than the ones on the left side. So today I went in, and my treatment was at 8 a.m. So it was pretty early in the morning. Treatment is roughly 45 minutes long, and that includes like both sides. So I'm in and out of there by 45 minutes about. Um, the intensity, they are increasing it as they go. So they want to reach the total of 100. They want to reach up to 120 in intensity. And they started me like 2 days ago with like 40% or something like that. And they've gradually been increasing it. And as far as like how hard it taps, I think that's what they mean by intensity, right? And they've been really good about accommodating me and asking me if it's okay for them to move up a notch. And when they do, they ask me if it still feels okay, right? They said they don't want it to be like super painful or uncomfortable or anything. And so far, today they did 75 on both sides, and it wasn't too bad. My eyebrows were twitching a little bit, and I explained in one of my previous videos that's because they sometimes stimulate the cranial. I believe it's the facial nerve that's responsible for like the movement of the eyebrow, and so sometimes that makes my eyebrow twitch, which is weird. But yeah, overall, it just kind of feels like a woodpecker pecking at my skull for about 45 minutes straight. Um, and, it's not painful or anything. It's just a little bit of an odd sensation. But as they increase the intensity, it may become more uncomfortable or painful. And if that does happen, I will be sure to talk about that on here. Um, I got more sleep last night because I took 2 melatonin gummies, and I've also been listening to like a meditation type song at night that helps put me to sleep. So I think I got over like 7.5 hours of sleep, whereas the past week I haven't been getting much sleep. I've only been getting like 4 or 5 hours. Um, and so I was in a better mood today. And I didn't feel as tired after the treatment, although I don't know if that's because I got more sleep or because I did the treatment in the morning as opposed to in the afternoon when I usually do it. Um, but yeah, so a little bit of changes in my sleep there. As far as what I did today, I just woke up, had breakfast, went to the TMS treatment, went to the grocery store with my dad, came back. Um, I'm trying to think of what else I did today. I had class. I'm taking a voice disorder class. For those of you who don't know, I am currently going through graduate school, and it's part-time and it's entirely online for speech and language pathology. I had class um, from 6 to 8. From 6 to 8, and then I met with my supervisor because I will be going back to work on the 29th because summer break is sadly ending, and I had a virtual meeting with my supervisor and the other SLP regarding caseload and what that's going to look like starting next week. I also had a meeting with my psychiatrist, and I talked to, well, yeah, I had a lot of meetings today. I talked to my psychiatrist about how I felt like I might be bipolar because I felt like I was having a manic episode. He said, 1 or 2 episodes isn't really enough to conclude that I am bipolar, especially because sometimes the symptoms of depression and ADHD, which I also have, and anxiety, tend to overlap with the symptoms of bipolar disorder, and it's kind of hard to tell. He wanted to start me on a mood stabilizer, I think Seroquel, which also helps with sleep, because I told him I've also been having trouble sleeping. But I told him I don't want to mess with my current medication too much, because I'm kind of trying to do a case study on myself for my own benefit and knowledge, because I want to see if this TMS treatment really is helping, right? And if I start making all kinds of changes to my medication, I might not be able to tell exactly how helpful it is. I drank a cup of coffee this morning, and it did make me feel more jittery and anxious than usual. My anxiety today was at about a 9, and my depression was the same. It was at a 7. Every time I go in every day, they ask me what the levels of depression and anxiety I'm feeling, along with other questions like, have you consumed any alcohol, done any drugs, you had any caffeine, have there been any changes, to your medication, or any significant changes that we should know about, because all of these things, of course, affect treatment, and they're trying to keep track of my progress. But yeah, so today, my overall mood was, anxiety was probably around a 9, whereas depression was pretty stable at a 6 or a 7, similar to when I started treatment. Today is only day 3, so I don't expect to see much of a change just yet. I'm still struggling with procrastination. I'm still struggling with task initiation, which I would attribute more to the ADHD than the depression at this point. My professor assigned an assignment she assigned it over a week ago, and it was due today. It's due today at 11:59, and I just finished it 10 minutes ago when I had over a week to do it. But I guess that's how it goes with ADHD. I feel like I always have to work in a panic-induced mode, or else I just can't motivate myself enough to actually do things in a timely manner, which really sucks. But yeah, so not much change in my mood overall. Treatment still wasn't painful. It was an odd sensation, but it was fine. And I actually did not experience a headache this time. So the past 2 treatments, I have experienced a headache after treatment, and I didn't this time. And I'm not sure if it's because maybe my body's starting to get used to it, or maybe it's because I had treatment in the morning, or I still felt a little bit of fatigue, but nothing too bad. But these are all common side effects of the treatment. So I went over what I did today, and how I felt. And what's the third? Well, the medication. What medication did I take? Just the 26.1 milligrams of Asztaryz, which is a stimulant medication for ADHD, which is what I've been taking every morning. And then who I saw today, I kind of went over that already, right? My parents, spent some time with my son, my nephew, my sister, my psychiatrist over Zoom, my supervisor over Zoom, and my professor and the rest of my cohort. So it was kind of a busy day. Yeah, so that is day 3 update, and I have my 4th session of TMS tomorrow morning. And as always, I will make time to come back and talk about it sometime in the afternoon or evening.